Gentlemen, has your doctor talked to you about targeted therapy for your prostate cancer? It pays to know the facts so you can understand the situation and decide what's best for you. Targeted therapy is generally recommended to treat metastatic prostate cancer that has stopped responding to hormone therapy and presents specific genetic mutations. Let's take a closer look. Most cancers are caused by acquired mutations which are not passed from parent to child. These mutations can be caused by the environment, diet, and aging, or by unknown reasons. A small number of cancers are due to inherited mutations. This type of mutation is passed down from your parents and is present from birth in your genetic code, that is, your DNA. All your cells contain a copy of your DNA and your genes. Normally, they have their own repair systems designed to correct any mutations. Unfortunately, some genetic mutations create errors in the cell's repair systems. Depending on which genes are affected, this can lead to instabilities in cell function and increase the risk of developing certain cancers. This is the case with inherited BRCA gene mutations and prostate cancer. All genes produce proteins, each with its own function. BRCA genes produce one of the proteins responsible for repairing damaged DNA. The BRCA proteins team up with another type of protein, PARPs, to repair the damage. When there are mutations in the BRCA genes, it increases cell damage and, in turn, the risk of developing certain cancers. Targeted therapy is designed specifically to address these types of cancer. It uses specific blockers called inhibitors to counteract the action of the PARP proteins. In doing so, PARP inhibitors prevent cancer cells from repairing their damaged DNA, eventually causing these cells to die. In concrete terms, the PARP inhibitor treatment involves taking oral medication. By targeting PARP proteins, the drugs stop the growth and spread of cancer cells while limiting damage to normal cells. That said, some healthy innocent bystander cells can also be affected. When this happens, side effects can occur. While some people experience no side effects at all, others have a few. Most of the time, these include nausea, anemia, or fatigue. Side effects are usually temporary, and there are medications that can help reduce your discomfort. You have the power to minimize some of these side effects. Be proactive by adopting a healthy diet that includes taking calcium and vitamin D supplements, being physically active, and getting regular checkups. Everyone responds differently to targeted therapy. If you start a PARP inhibitor treatment, get in the habit of monitoring your health and note any changes in a journal. This is a great way for you and your healthcare team to identify any new symptoms or side effects and address them right away. Communicating with your healthcare team is just as important as taking your medication and getting treatment. Make good use of your follow-up visits to ask the specialists and nurses for advice. Tell them about any issues or symptoms you think may be related to the targeted therapy. The sooner you let them know, the sooner they can help you improve the situation. Questions or concerns? We're here for you. Procure would like to thank the specialists, nurses, and patients for their help in the making of this video.